Auricular medicine is a form of neuromodulation. We have access to the entire brain on the ear. The ear is a reflection of the brain. The precentral and the postcentral gyrus on the frontal and the parietal lobes are reflected on the ear. So that means that everything from this finger to my knee, to my liver, to my psychological traumas, everything that is going on in the brain and the body is projected onto the ear. We have access to all of it.
German auricular medicine is approved by the National Certification Commission for Acupuncture and Oriental Medicine, as well as manual therapy associations for continuing education credits. And it's internationally used by medical doctors. More importantly for us as therapists, auricular medicine's research supports vagal regulation. It aligns with the work of Stephen Porges, Peter Levine, Bessel van der Kolk, and other leading experts in our field.
The ear is a map of the brain. It's a map of the brain's map of the body, but it also contains the entire psychology. It's interesting because I'm not a psychologist. I'm a licensed acupuncturist. And I remember when I was learning this medicine, I was actually astounded to find that the ear gives us access to the brain with all the information that the brain contains of the physical body, but also of the psychological. This includes the conscious psychological, but also the subconscious psychological. So this is very, very valuable information because the subconscious psychological will present on the ear as a tender point.
Sometimes I'm just like, man, if a psychologist had their hands on auricular medicine, you know, like the power that's behind a psychology practice and what they could do with this added tool is just incredible. And I just want to be able to pass this on to the world of psychology. My name is Dave Maybee, and I am the lead instructor and the director of the Canadian Institute of Auricular Medicine. In auricular medicine, we know that the ear is a reflection of the brain that is current and dynamic. It is showing us what is really going on with our patients.
We are able to differentiate through tenderness on the ear which part of the body or mind needs assistance. And the parts that don't need assistance will not be tender and will not need treatment. And this is invaluable as a therapist. You can access parts of the body that are normally not accessible, like a hypothalamus, pain memory, or an emotion, can all be accessed through the ear and they're normally not accessible. It also gives you all the information that your patient didn't tell you about, even things that the patient actually have forgotten themselves, an injury or trauma they had as a child that they're not consciously thinking of or that they don't know about. A large amount of information in a very small amount of time, and it cuts out an enormous amount of us guessing.
The way that we approach this is less of a protocol and more learning the map of the ear and really thinking through what points possibly could be active, and then finally trusting what the ear tells us. This is the most important part of auricular medicine.
So in this course, we're going to be teaching you to access this privileged information from the nervous system as an adjunct therapy for your practice. So discovering new information that you might not have known before, but also information that confirms your treatment plan or potentially modifies your treatment plan.